It's rather glum and rather icy morning, and very grateful that MLU has made it this far. We became 2 this year. Whoop, whoop. Yep. A milestone in and of itself. And in these 2 years, we grew from just 1 person with a long distance assistant, that would be Susanna, who is helping us today, to a 9-member organization consisting of part-time, full-time staff and dedicated consultants and contractors who help us design our programs and get our work done. I also want to highlight that we've been very lucky and very blessed. During the past 2 years, we've also been able to raise a little bit over $1 million, which I think for young organizations, that is highly unusual. And it's all thanks to being part of Maryland Nonprofits. Thank you, Heather, for taking us under your wing and believing in our community, but also in our leadership, as in Ms. Veronica Kuhl, who is also with us here today, our founder and chair. And because of the generosity of our contributors, we have thus far created 2 what I consider very strong programs. First and foremost, a health equity program that emerged out of the crisis of the COVID-19 pandemic, which is led by our senior program manager for health equity, Walter Saba, who happens to be in sunny Brazil right now. Lucky him. Through this program, we are raising awareness, bringing information, and supporting agencies and other nonprofit efforts to help them connect the dots between community and themselves and leverage what they do to provide services to the Latin community, while ensuring that the community then receives bilingual, bicultural, multicultural information and materials, and expert bilingual multicultural staff, and my beautiful steering committee members. So I really wanted to raise these folks up for a variety of reasons, but also to demonstrate how many countries are represented in our work. Our staff, steering committee, and consultants originate from a number of Latin American nations. And I'm just gonna name a few: Peru, Guatemala, El Salvador, Nicaragua, the Dominican Republic, Puerto Rico, Cuba, and Argentina. I myself am originally from Mexico, though I grew up in San Juan, Puerto Rico. But I also lived in Chile and worked throughout Latin America in my career, and the same with our directors, our managers, our specialists, who are, and many of our steering committee members. And I think what this happens then is that we bring our cultural knowledge to the table to ensure that we are all understood and represented under this rather large umbrella that is the Latino community across the state. MLU's programs, I just want to be really clear, we're not meant to provide direct services so much as connect the dots in the areas, especially in the health equity space, HIV self-testing and consciousness raising around infectious disease and epidemiology, mental health and stigma, health literacy. And of course, we continue to do our work on COVID-19 to debunk myths and learn more to improve health literacy within the community across the state. With this cultural knowledge, we have also, and I'm so excited, able to create the bilingual multicultural MLU capacity building program, which is led by Dr. Almarie Donaldson. She is a Guatemalteca. This is a program which we will strive to eventually turn into an institute focused on leadership, strategy, and innovation, to help the Latin community help itself with all the tools that it needs and that are available to ensure that Latin nonprofit organizations are among, so it's a goal. We want to be among the top performing nonprofits in the state, and maybe even serve as a role model or a strategic model for the nation. So more to come in 2023 as we get these, continue with our programs. And just to reflect a little bit and briefly, 2022, I think, was one of really crazy learning curves for me, at least, and I think for our organization. We increased our outreach exponentially by developing strategic communications. Though we still have a few more weeks to go to round out the year, we are already looking forward at 2023 and really to ensure that Latinos and Latinas in the state of Maryland have a seat at the table, access to the services that they need, and the removal of barriers to that access, which initially we know are barriers like language and what I call cultural relevance, but it's more commonly referred to as cultural competency. Before we get started, I am going to share just 3 lessons that we learned as a nonprofit organization serving the Latina community. The first is one that I'm really proud of, and it's the one that really burst us open, I think, which is convene, converse, cultivate, and collaborate. This became our mantra in 2022. In mid-2021, we launched a coalition of organizations focused on supporting Latinx vaccination across the state. We lovingly call it MALVEC, which stands for Mid-Atlantic Latinx Vaccine Equity Coalition, quite a mouthful. Our partners include 2 of the largest universities serving the state, Johns Hopkins University and the George Washington University Milken Institute of Public Health. The idea to do this came from a young Latina, and this goes to the whole idea of convening, conversing, cultivating, and collaborating. Laura Gutierrez in Annapolis, she's not with us today. She is busy finalizing a big social justice report for a program that she launched and that we helped to staff actually in early November, I believe, or late October, I can't remember. I think it was early November. So what she did was she brought us all together, and the seeds that were cultivated allowed us to be part of something rather incredible. Together with our partners like Casa, Center of Health, Cheer, we leveraged our knowledge and resources. We partnered with other folks, the Maryland Department of Health, the CDC Foundation. We actually had 92 small partnerships with small business, other nonprofits, depending on where we were going to serve the community to ensure that they got vaccinated. But we didn't do the actual work. We brought everybody together. We follow up with the report. We administer the grant. We help connect the dots. We brought in other organizations, hosted meetings. They did the work. And what we did was facilitate what they did and help, again, I repeat, leverage resources. So now this continues. We still do this work, but our role has really been more in starting to understand the lessons learned. So we've been doing a series of community surveys in Prince George's and Montgomery County and Baltimore. We've done about 300 at this point to really understand where health literacy is at in the state, in our community. The other lesson, bilingual and multicultural services make a difference. We all know this, but we really saw it. We've learned that part of the reason there are gaps in services is a lack of bilingual and multicultural capacity building information, as well as there really hasn't been a whole lot of effort to ensure that as organizations that grow out of need in the Latina community, that we have access to important tools for advancing ourselves. Again, we're not here to tell people what to do. We are here to ensure that there is information about the quote unquote rules of the road of managing a nonprofit and starting a nonprofit, which is the real bread and butter of Maryland nonprofits and why we are housed within this organization. We have been hosting roundtables on capacity building to better understand and assess where the community is at, what they really need, and how we can best serve them so that everyone can progress. And this isn't about us, it's about our community and our leaders. And the third lesson, and nobody's going to be surprised hearing me say this, representation matters. We also had some lessons in the power of representation and allyship. What that means in terms of impact to the community is that when there are Latinas and Latinos in leadership, the likelihood of having a better experience as a community and addressing the needs of said community, it grows exponentially. Until the last election, there were only 4 Latinos in the State House. Now I believe there's going to be 6. In 2022, as we did our civic engagement work to educate the community about the electoral process, and Veronica was very important in that role, we realized that something like 20 plus Latinos ran for office across the state at the municipal and county levels. We now have 2 mayors who are Latinas in areas where we are, where we are growing exponentially. But the point is that sadly, that growth, that leadership growth is still moving a little slow for our needs. And we need to continue to improve that. The point of this thing is that with Latina leaders and allies at the table, we can make a big difference. Without our allies, and I really want to highlight this, without our allies, we cannot improve. So there are many other issues that I can discuss, but we're not here to talk about our organization and our work. We really are here to discuss the work of some of our partners. So I'm proud to have the opportunity to hear. We're going to hear from Walkiria, the head of the Centro de Apoyo Familiar, CAF. In English, it's the Center for Assistance to Families. Their mission is to transform communities through economic and educational empowerment in collaboration with community and faith-based organizations. We also have with us Suyanna Linhales Barker, the interim chief programs officer for La Clínica del Pueblo, which literally translates, and I love this, to the People's Clinic. Their mission is to build a healthy Latino community through culturally appropriate health services. Welcome. Bienvenidas a las dos. I am bienvenida a las dos. My Portuguese is so bad. I'm going to keep trying, Suyanna. So let's begin with a brief introduction. Let's start with Walkiria. You can go first, and then we'll pass it over to Suyanna. Tanto gusto en verte otra vez. Tell us about yourself, your journey, and your work at CAF. What does living CAF's mission look like for you? And you started, and I just want to make sure we ensure that we talk about how you started. So you started in 2006, and your organization began in Massachusetts, right?
That is correct.
Okay, so take your time. You got 5 minutes apiece. Tell us a little overview and share with us a little bit about your personal journey, because I think it's really important for everyone to understand where we all come from.
Thank you, gracias, Gabriela, for this great opportunity to be here. It is actually for me a great pleasure to be able to share a little bit about the work that we do. As you mentioned, yes, we started in Massachusetts, and part of my journey, is what kept me connected to what I'm doing today. I'm an immigrant. I'm one of 5 children. I'm the one before the last out of the 5, but I'm the baby daughter in my house. But I came here when I was a young teenager with my mom. My mom became single mother pretty close to when we came to this country. And every Dominican, they have to do the first, well, almost all Dominicans have to do the first stop in New York, and then from there go somewhere else where they can get jobs or get displayed. And so yeah, I stopped in the Bronx first, and then we went to Massachusetts in the city of Lawrence, which is a small city made up of mostly Dominicans and Puerto Ricans. So it happens that when we got there, we were, super excited because we had a lot of dream. But there was a lot of challenges, as you might know, a single mom with 5 children, mainly teenagers, was very challenging. It happened that we didn't know the system, we didn't know the culture, we didn't know the language, we didn't know anything. And so I saw my mom suffer a lot through the process. And so I remember we got very connected to our faith leader, a pastor. He was the one that opened up a door for us to get housing, food. We used to go to all this food distribution to be able to be fed 5 kids, and it's 6 people to eat. That was pretty big. And so, and all the other stuff, we I think through the challenge, those are the time where you really learn and you appreciate that every single thing that you do matters. Even though we came to this country for a new future, my mom always said, we don't want you to be part of the statistic where it said that many Latinos, especially Dominicans, that was, the stereotype there. They will come, they will not go to school, they will not, further their education and continue to move on. She's like, I want to make sure that even though you guys are going to be in this country, you will be able to really continue and improve yourself and also add into this society. So education was always first in our head, and faith. So part of what she did was kind of encourage us to follow that. So in long story short, after I finished school, I decided to go on and do my master in community development, housing and community development. But all of that to say that at some point I had to reflect and say, why did I have to go through all this process in my life, me and my siblings? my siblings and I, and my family in general. There is a reason. And we kind of, my sister, which is the co-founder of the organization, we started to ask ourselves, maybe there is a reason for all of this. And now it's time for us to go back and learn, from what we went through and what is missing, what is the gap in the community. And we felt part of the gap is there was not enough information about the resources that were there. There were many resources, just that we didn't know where to go. And we really felt that our leader, meaning our faith leader, who is the person that you trust after you parents, couldn't help you either, because he himself, an immigrant, didn't know, and his colleagues within the faith community. So that's when we decided to form this organization and empower the faith leaders, knowing what are the resources for the community, how can they become more holistically involved in the community and be able to to serve the community again in a very holistic way. So CAF, then I got married, and I tried to convince my husband to move to Massachusetts, but he was like, it's too cold. There's no way I'm gonna be living there. So I have to move here to Maryland, and I'm glad I did, because oh my goodness, I had no idea how many opportunity I was going to face and what a community it was going to embrace me. And so in 2009, 2010, when the foreclosure crisis began to hit, between my transition of 06 to 09, a lot of things happened. I needed to get a job. I went to work for La Raza, Unidos US now, where I worked there for a few years. But something happened here where, I think everything happens for a reason. Given the fact that the crisis started to happen, the foreclosure crisis, the organization was running in Massachusetts, but I realized that my own community then was going through foreclosure. And so many people were going through so many things. Again, my church members were facing those situations. And that's when I decided to open up a chapter here in the state of Maryland. I decided to live in CLR back then, now Unidos US, and begin to work out of my home and say, listen, I need to start helping people. I remember the first community fair that I had, 216 people show up to a church. And all these people, the line was huge, people looking for help. And I was like, what am I getting myself into? Yes, there was a lot of need. I did not know, even though I was at a national level working on the housing issues, I did not know what was happening in my own community. So that's how we started it. From there, we are now in 4 different other states. We are in Northern Virginia doing the same thing. And why? Because so many people were driving all the way from Manassas, from Prince William, from Northern Virginia to Prince George's County to see us for help. So we needed to help them. And so we opened up that side, and also in DC, where we also doing a lot of housing and environmental justice work. So that gives you a sense of why I'm here and why I need to continue to do the work we do, because our community needs us.
Wow, what a story. I hear so many themes that are, well, they relate to all of us, actually, and all of our experiences, especially education. That's always the first step. So, Suyanna, once again, I'm going to try my Portuguese. Bem-vindo à série de políticas do povo. Why don't you share with us your journey? And because yours is also, I mean, you're from Brazil. It's a little bit different, but very similar, I would think. And but also the very important work that Clínica is doing for the Latino community. If I'm not mistaken, Clínica started in 1983, and it was really the product of that first wave of migration from Central America related to the Central American Wars. And so many people ended up as refugees and asylees here in the region. Maybe talk a little bit about that and just your experience and why you do this.
Thank you. I mean, fascinating, Walkiria, to hear your story too. Also the story of women, right? Carrying and pushing. And I think my story is, I came to this country from Brazil because of love. I fell in love in Brazil. Actually, I married my my husband in Brazil because he needed a visa in Brazil. Is a story different than usually? Because he was working in Brazil.
It's usually the other way around.
I know, it's so interesting. So, and we lived there, and I never really thought about migrating to US. Actually, I never thought about migrating because my family is I'm the second generation of migrants in Brazil. So I think after migrating here, I understood how much it was tough for my family to migrate from Italy and from Lebanon to Brazil. And then the generation of my parents, they become Brazilian. We could not speak another language that was not Portuguese. We could not identify ourselves with anything that was not Brazilian. And I think sometimes immigrants do that, right? They need to settle down. They don't have a way back. Both families was migrating from Lebanon and Italy because of hunger. Extreme hunger was the end of 19th century to 20, and arrived in Brazil. And I arrived in Brazil with a lot of privilege because Brazil was a 90% Black in the beginning of 1900s. But all the Blacks were not considered citizens because they were just had the free from slavery. And the community in Brazil was always considering anyone that comes from outside better than the ones in Brazil. And then my generation having all the privilege. Also, my generation was lucky enough to see the country re-democratize. Brazil was, when I was born, Brazil was under a military dictatorship. And then as a teenager, I saw the system open up, and I was also lucky to see a new constitution, which give a lot of, a much more inclusion for people. And in my tradition, because of this, and because of the privilege of being white in Brazil, I had all my education in public schools, from elementary to my doctorate degree. Everything was paid by the government. And that's what helps my family migrating, starting to live in Brazil. And then on the possibility of a system become more inclusive to everybody, become inclusive for those who also easier to be inclusive, because as I said, being white in Brazil, you have a lot of privilege. The teachers push you up in many different ways that you just realize later when you're in the doctorate degree and you don't have any Black students with you. So you have them in the beginning, but you don't have them at the end because of how the system pushing people out and give some privilege. Mm-hmm. All this I was understanding Brazil, and I only thought we need a fair society. And living in Brazil, I started doing my career to bring primary care and the understanding of primary care to communities that was unserved. I was trained as a psychologist, then I did my master's degree in social psychology, understanding violence in the favelas in Brazil, and then end up doing my doctorate degree in public health, understanding how to take healthcare systems into those areas and talk to the young people. So this could be part of the assessment to protect the violence to not be replicating. So I think it was good, fine, but then I fell in love. And I thought Gary was going to be forever in Brazil because he's kind of like a nomad person, but he felt the call. He felt the need to go back here to be with his family. And since he has been there with me for so many years, I came with him. And then I understood discrimination in my own skin. Before, discrimination was a little bit an abstract that I was paying attention and that I want to change, and I have live in a more equal society. I felt as a woman discrimination, but it was the first time that I felt also as a person who cannot really share the language. The first time that I went to a doctor in the US, I could not communicate with the doctor. The doctor did not offer a medical interpreter to me. And the language barrier, and the fact that on a language barrier, you feel always less smart, less intelligent, less sophisticated, because language is how you show how much you were educated, how much you were sophisticated, how much you can express yourself. Mm-hmm. If you lose that ability, automatically you become someone that people think is dumb, less smart, less capable to work, less capable to take care of yourself. And that was interesting because I think I relate to that young people that I was working in the favela in Rio, when they said, when I go to the hospital out of the favelas, I felt dumb because I didn't know how to explain to the doctors and nurses what was going on in my community. And I felt the same thing here for the first time. I cannot talk to this doctor. He's not going to understand where I come from. And he thinks I'm the problem, right?
Mm-hmm.
And I think that the fact that we have different perspectives and different culture and different language. So that makes me want to find a way to work in US with public health too, or at least with very applied work. When I arrived in DC, I was seconded by the State University in Rio to the Pan American Health Organization. I think the idea of doing international work and also be far from the community where I live and work, I didn't like this idea. It has been all my life, I've been doing very community-based work. So I started finding my interviewing, trying to find a way around, and then I found La Clínica do Pueblo. So La Clínica was at that point, 12 years ago, hiring for a new position for a new department that was called Community Health Action. The Community Health Action Department of La Clínica was a combination of what was before an HIV department and outreach department that used to run a lot of health fairs. So La Clínica merged those two departments on a department called Community Health Action, and they hired me. And I was lucky enough to find a place to work and apply. Now to the US, this idea that healthcare is a human right. Mm-hmm. Healthcare needs to be delivered in a way that takes into consideration people wisdom, not only science wisdom. And the people wisdom sometimes even inform science where things should go, on how things should be perceived. I think this dialogue between anything that we can use as science with everything that people live on the day-to-day and how we implement science on the day-to-day is pretty much the solution for us to close the gap, right? And people don't feel a way to enjoy all the information that's as humanity being accumulated with science, but apply this to their real life, apply this to day-to-day life. So that conversation, that communication was what I would do in Brazil and what I'm doing at La Clínica now. La Clínica, as Gabriela mentioned, is next year going to be 40. And it started actually as a social movement more than a health clinic. This is important for us to understand. DC has a network of federally qualified health centers that they were all born on the social movement. Mm-hmm. You have Bread for the City that comes from the hunger and dealing with access to healthy food. You have Community of Hope that's pretty much from the housing social movement, like how to helping people to have more access to affordable housing. Wisdom Walk Health that come from the LGBTQ social movement. Mary Center comes from the women's movement and how to have, and La Clínica is from the Central American immigrant movement. La Clínica started inside Carecen, which is an organization who provide Central American kind of, it's like a settlement house kind of model, like is a resources center for the Central American. The influx of Central Americans in the 80s, and also the fact that DC, that point, realized all the Central Americans was in Mount Pleasant. We have the riots, we have all the violence that happens, and then all the organizations start showing up to help the community that was really fleeing a war with a lot of health and mental health problems, and also language and cultural barriers. La Clínica then started as a night clinic just with volunteers and doctors that need the community members to become their interpreters, but also their cultural brokers, right? I mean, a lot of the tradition of La Clínica having community health workers, we call them promotores de salud, come from that initial setup. Doctors need someone explain to the doctors what was the journey, what was the problem, how health was perceived in their country, what kind of treatment plan they would accept and would not damage their beliefs or their traditions. So with that, La Clínica, also after that, La Clínica become the group work at La Clínica become very worried about the amount of AIDS among the Latino community in DC in the 90s. And started open up the system for the people living with HIV. And I don't know if you all remember, the old one may remember, we had late testers among the Latino community. So a lot of the people that get to us at that point was already with AIDS and already in a situation that is very dramatic. So we start receiving Ryan White funds to see if we could, Ryan White and CDC funds to see if we could start reaching out to the community and make sure people get tested as soon as possible. And we try to provide treatment as soon as possible too. Because of the amount of, because of the success there, right? Because for the Latinos didn't have, sometimes were not, the LGBTQ community was not welcomed in the more traditional Latino organization, and also not also on the healthcare in general, because people didn't understand them. So La Clínica ended up being this possibility of having an inclusive, culturally linguistic appropriate system for the LGBTQ community. And the influx of Ryan White funds actually pushed La Clínica to become a federal qualified health center. So in 2008, La Clínica applied with other, actually it was a movement among the centers, the health centers in DC. A lot of the health centers in DC that before was like just a social movement providing healthcare as a free clinic, end up going to this kind of wave of becoming a federal qualified health center. And today, La Clínica, at that point, we could see like 100 or 200 clients a year. After becoming a federal qualified health center, we can see 4,000 people per year. Wow. So there's not a big size for a federal qualified health center. If you guys in Maryland, if you see the amount of people that CCI say, the amount of people Mary Center can see the greater. La Clínica is very small, especially in Maryland. Us going to Maryland was 6 years ago because of the gentrification in DC. We have a lot of our community members moving out of DC into Prince George County, and then we thought it was the time for us to go there. But it has been very hard to finance healthcare in this country. Healthcare is very expensive here in general. And when you have to finance healthcare for people who does not qualify for Medicaid and are poor, and cannot really afford a health insurance, a private health insurance, or does not have work conditions that give them health insurance, is really hard, because as an organization, we have to fundraise to pay for everything. The problem is healthcare in general is an expensive business. Right. The labor force for healthcare, we compete with private sector, right? When we try to hire a doctor, when we try to hire a nurse, when we try to hire any people around us, therapists, psychotherapists, competes with salaries that is really prohibitive for non-for-profit. So it's very complex. It's very complex to not have only a volunteer-based healthcare. We do believe La Clínica healthcare should not be volunteer-based, because we believe should be with a good attachment between the client and the provider. Right. Unfortunately, when you work something that's volunteer-based, you cannot have the same provider over time. Right. And the provider has even well-intentioned and very important. So we do have volunteers, don't think me wrong, because it's better than nothing. But what we try to do is to create a system that has quality of care that includes a long-term relationship with your provider. It's much easier for a person who has a chronic disease to overcome, or even to change behavior, or even accept some of the changes they have to do in their life if they have a good relationship with the healthcare provider. Also, we do believe providers should not be only a doctor, should be a team that can, an organization that people feel always welcomed, especially people who have limitations. I think a lot of the low-income communities, they think they have to be ashamed of being poor, and they have to be ashamed of need support. And we try as much as we can to tell people that government-funded healthcare is not because you're poor, it's because you're human and it's your right. This is not something that people are giving to you as a charity. Right. Healthcare is basic right. Everyone should have. You should not be ashamed of it, and should not be ashamed to go to a clinic to get healthcare.
So let me stop you right there, and because you've both raised a whole bunch of issues, and actually, you know, like, I don't want to say trends, but a process that you've gone through as organizations, right? And as leaders within these organizations, within your areas of specialty. I think it's really important to understand the impact that our Latino organizations have had on our community. You both talking about this. It sounds like both of these organizations, and like we did, came out of crisis. Right? We were created during COVID. There's no state infrastructure. We were, you came out of the housing crisis in 2008, and Walkiria, I'm sorry, and CAF come out of the whole, like, the Great Recession, as we were calling it in the Obama administration. And then obviously La Clínica is a response to a social movement related to war and violence. So let's talk a little bit about the communities themselves. You started to talk about, sort of the areas of specialization, but also maybe continue to dig into the work. Because CAF, for example, I know you do provide a lot of education around housing and really like basic stuff, like, well, not basic, but important information around banking and finance and how do you economically, that's a social determinant of health, right? How do you economically raise yourself up as a community so that you can gain access, so that you don't have as an individual or as a community, we don't feel badly about quote unquote being poor. What does that mean exactly? And psychological impacts, but also very real ones around basic services. Maybe talk a little bit. You also do a lot around environmental health, Walkiria, which I love. It's one of my personal passions, but also your work with the pastors and the churches. And then, Clínica, you're providing healthcare services, but you're also doing a lot around community organizing. You both are. As a result of the services you're providing, you're actually building policy priorities and ideas for engagement for community organizing. Maybe talk a little bit about that impact as well as an extension of your work. Maybe Walkiria, you start.
Yeah, no, absolutely. Thank you. And I think one of and I will put it in a general way, a lot of the organizations, especially Latino small agencies, we tend to focus a lot on the programs and, focus on the people and the need. Then that part of advocacy and really changing legislation is something that is huge. And, through the time we realize that has to go hand by hand, because if we don't make changes and we continue to see the same pattern, we're gonna continue to see the same results. And one of the things and a strategy that as an organization we have start to do is just do more organizing, and also at the same time be more engaged in how we can shape policies, because we notice that our people continue to face the same thing. We continue to see that even though programs are created, they're not really developed in a way that will fully and successfully impact our community. And I'll just give you an example. We just went through like the rental, COVID program, and a lot of our program, like I felt so bad that even though we did a lot of community outreach, many of our community couldn't really benefit for this program because it was set up in such a way that our community was gonna fail. There was a lot of need of digital literacy for our community. We realized that our community is they're few years behind compared to many other community. So one of my things is sometimes we get in a room and we think that Black and Latino can be served equal. I mean, the same way. I'm not talking about equally, but the services are to be provided the same way. The need might be the same, but the way that we provide the services to our community, that has to be completely different. The policies that are made for our community, that have to be shaped for our community. And so I went through a lot of situations where, our community get to be, just being undermined because we're not really being served at the level that needs to be served. And that's because we are not on the table, meaning those who are that really work in the community, when those programs are decided, we are not on the table to make decision in, at the legislative work level. And also, we don't have a lot of advocate voices out there for us. And I'm so glad, I mean, the statistic that you mentioned at the beginning on how now we have more Latinos in, in Annapolis, is something that is huge for us, because believe it or not, sometimes you want to bring somebody to share a testimony, and they, unfortunately, language is an issue. Sorry about that, no, it's my door. Language is an issue, and you want to bring people that can share that, but they don't speak English. And so we need to find ways that is more a level up for our community. But then at the same time, just briefly, in helping that community and the need, and beside the education, which is huge, awareness and education is something that is always going to be needed. But I feel that we need to start preparing leaders that can actually work and be helping us at the level that we need to be helped. We need to be getting more organizers. We need to get more people that are, Latino, that can actually understand legislation, that can actually understand how the legislature work, and that are from the community. We see a lack of that. And that's one of the things that now we're working on, preparing leadership for that, and, kind of giving the empowered. There's a lot of fear too in our community. And, and I will tell you this, people get assumed that because you're educated, because you're a leader, you understand everything. There's a lot of people don't know how to really get their voice heard because of lack of confidence, because lack of information, because of fear, and because not understanding the system well.
Suyanna, how about the work that the Clínica does? And because I know you do a lot of community engagement. We participated in one of the convenings you just led, last week, 2 weeks ago? And it was really all about policy, right?
Yeah, I couldn't agree more with Walkiria. I think on that perspective, around 3 or 4 years ago, Clínica decided to organize a little bit our advocacy intentions. I think as with this name, Clínica del Pueblo, and being 90% immigrants who work at Clínica, in the past, we've been called a lot to represent the Latino community, right? Many times you need someone at the table, for example, in DC, in discussion, La Clínica can represent the Latinx community. So La Clínica represent the whole community. But it was so disorganized that we decided to develop an agenda. So we decided to develop an advocacy agenda because La Clínica uses a social ecological model on health. That means you can provide healthcare, but you need to educate the community and you need to impact the policy. If not, you keep taking care of that individual and you throw them back on the community, they get sick again and come back to you. So become like this boomerang. And the providers keep sometimes blaming the person, not understanding the system. So we decided to do let's understand what health equity means with the socio-ecological model. That's a public health kind of theoretical framework to do that. So we need to develop actions that are to impact the public policy. We need to develop actions to educate and promote awareness in the community, and you need to provide healthcare to individuals. So we control more in terms of who is the person that we are talking to the clinical, right? That clinical, we know exactly. So when you need health outcomes, for example, we know from the clinical. On the community level, we have awareness, and we have this health communication initiative who try to get people involved with information as much as we can, but also distributing materials, going where people are, health fairs, nightclubs, churches, business distribute condom for us. We have a very distributed action on the community in DC, and in Prince George, we're getting there. It's not as good as DC.
Well,
DC,
no, it's a slow process.
Yeah. And with the advocacy, we decide to have one big ask in terms of policy and try to talk to about this everywhere that we go. That's we call that health without barriers. That's the salud sin barreras. We decide that as a healthcare providers, we can explain to a lot of folks how many people are out of care and why they're out of care. And they should not be out of care. Healthcare is a human right. Healthcare should be for everyone. If you have a society who leave people behind without accessing healthcare, you are not in a safe society. And people, to leverage a field for everybody has the same opportunity, everyone has to have access to healthcare. No matter what you are, where you came from. But not any healthcare. You need a healthcare that people trust, right? You cannot just give people a Medicaid card, and if the doctor who is going to see that person doesn't understand the person is not going to go back to the doctor. They are going to have access to Medicaid, but they are going to use it. So you need access and quality. So, and then we participate in many different coalitions because we need partners to do that. I think what you said before, Gabriela, I think the mission that we have cannot be done by La Clínica, right? The La Clínica mission, we can take care of 4,000 people. That's our mission. Then we can also need partners for that. We need the other health centers. We need the specialty care. We need image centers. We need partners on that too. But to voice this idea of health without barriers, we need partnerships. And what we do, we participate in coalitions. So last year, among us, we participated in 36 different sessions in different coalitions. We participate with Casa. We recently met Carlos and then Gabriela through a Casa meeting. We participate in coalitions in DC. We participate in coalitions that has to do with housing, gender violence, gender-based violence, food access, because we believe the health, legal services. We participate in all the coalitions about legal services because we need adjust people's immigration status many times, so people too can follow the treatment plan that doctors set up to them. So we believe that only in partnership we can do things. And unfortunately, our day-to-day of implementing, financing, and dealing with operations, sometimes we don't have time to meet our partners. I love to be invited to an event like this today, for example, to meet new people, to spend some time knowing what's out there. I think we're going to try to do more of this. The last 3 years was really tough for us. Now we're still short in personnel. I don't know where the nurses went. I like to make this joke that all the nurses are in some kind of island somewhere because they're working. They got so burned out from the first 2 years of the pandemic that I think they disappear. So we're still rebuilding, we're still hiring people. Has been really tough for leadership positions. For example, we have a mental health department who does not have a director for the last 2 years and a half. Oh, wow. So this is hard. We have also the nurse management program without a director. So we are trying to rehire to rebuild what we have to do. But I think only in coalitions and only in organization like, what you are trying to do, Gabriela, with the Maryland Latino Needs, put people together, connect the dots, right? I think sometimes we have this idea of fundraising and a perception of competition instead of perception of collaboration. I think sometimes we let the collaboration only when the funder asks you to have an MIU with somebody else. We go extract an MIU, but there's few spaces for us to build partnership before go to funds together, for example. And I do believe that more and more financing health equity would be a combination of issues together, right? If we go solo, we're going to have less impact. And I think building those partnerships before funding can help us to really create a program that's really what our community needs.
Yeah, I agree. So we have only 6 minutes left of our time. I have like 5 more questions I want to ask you both. This is so fascinating. So you're going to be invited again, and we're going to keep this conversation going. Also, for everyone, we're going to host a health equity meeting, Latino health equity meeting on the 21st to start doing exactly what you're saying. We're going to invite everybody to a statewide table to really start thinking about what does a health equity alliance, what could it look like for our community? What kind of leadership do we need? Do we want? Who are our leaders that we don't know, right? Connect the dots across agencies and clinics, et cetera. And obviously you two are invited. If you haven't received I think you've already received the email though. And I need to send links and all these other things. So I usually, I want to thank you both. I usually wrap up by allowing Veronica to give the final 5 minutes, but I really want to praise you both for your vision and your kindness. You're just so generous with your time and your thought process and your willingness to collaborate. Doing this kind of work is sometimes you get told no, right? No, I don't want to collaborate because of what you just said about the resources. But the idea is to grow the resources from my perspective. And only when we build power together can we insist that our tax dollars deserve resources in return as well. And it's always, it's always better to do it together, like you said, than by yourself. So Veronica, let me hand it over to you. I have goosebumps, ladies. I just want you to know, I have goosebumps.
Now, it feels amazing to participate in these meetings. And Gabriela, you do an outstanding job of showcasing the talent that we have. Con Walkiria, con Suyanna, tenemos, our community is so incredibly talented, and we don't often pause for that second to celebrate. So, Gabriela has been great in that regard, and I want to shout out to Heather, because I'm like Gabriela, I just put my nose to the grind and I work. And Heather taught me a really good lesson a couple of weeks ago where she paused and said, look what you've done. So in 2 years, our organization we've served probably 50,000 people in the state of Maryland. And I don't know if it was Walkiria or Suyanna who said it. Maryland is behind, about 30, 40 years behind. We don't have resources. We don't have language access just because of our location. We couldn't figure it out. But look how quickly the work of Walkiria, Suyanna, Maryland Latinos Unidos is. So again, this is my perpetual plea. Let's not work alone. We cannot accelerate. We can't impact people effectively if Walkiria se queda allí, Suyanna se va por allá. We need to start copying each other, amplifying each other. I'm not an expert at everything. I'm bringing in the experts and I'm going to let them do their job and shine. So that's our superpower, is let's collaborate. So if you're not a member, if you're not thinking big things, señores, the reason we're stuck is because we keep thinking tiny. Vámonos, let's blow this. I can't curse. They don't ever let me curse. So let's go, let's blow. Vamos a hacer una vaina grande. We have the talent, we have the drive, as immigrants, as moms, as women. We don't know how to not do stuff. So my plea for Christmas, my plea for the holidays is 2 things. Let's give ourselves the gift of savoring our successes. Que hemos hecho mucho. We've done a lot. And let's be smart. Let's be way smarter. We don't have to work so hard. We just got to make sure we have the right people in the room and we empower them.
That's right.
I don't have to do Walkiria's job. She's killing it. But if I can elevate her, if I can give her the access, the money, the connections, then she can go 1,000 miles higher. That's all her. So savoring and let's be a lot smarter. So this is what MLU is all about. So if you don't know the players, if you didn't introduce yourselves, make sure you follow up. That if you hear somebody that rocked it and you're like, oh, I got to talk to that person, follow up. That's what this is about. Don't wait for an invitation. So Feliz Navidad, mucha salud, mucha prosperidad, mucha paz. And let's make 2023 about being better. All of us, not just 1 or 2, but all of us. So.
Thank you. Thank you both. You're incredible. I'm now a big fangirl. I already was from a distance, but now that I get to know you, and I do very much hope that we can continue to partner and really launch 2023 with some great ideas. Health sin barreras, that's great. I think we all do that. We all want that. And juntos podemos más, right? That's our lema. Together we can do more and we are stronger. And that gets us to the final minute. I think we can wrap up, or we can stay on for another 2 hours because we all have a lot to say. I want to thank the audience. Todos ustedes son preciosos. You're just beautiful. You're always here backing us up. We can't do any of this work without all of you. You're very important to it. And the willingness to listen and ask the important questions, ask the right questions. Sometimes that's even the most important part. If you don't ask the right question, you don't get the right answers, right? So, muchísimas gracias. Feliz año a todos.
Obrigada.
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 Ai, muito bem.
Muito obrigada, obrigada.
It was a pleasure. Thank you, Gabriela.
Thank you. Thank you so much.
Gracias.
Gracias a
Bye.
ustedes. Son bellas.